Hey everyone, it's Bwalia here, and today we're talking about something super important for women's health: high blood sugar and diabetes. Diabetes is a growing concern, and early detection is key to managing it effectively. That's why it's crucial to be aware of the signs and symptoms that could indicate high blood sugar levels. We're going to cover 12 of them today. By recognizing these signs early, we can take proactive steps towards better health. If you or someone you know experiences any of the symptoms we'll be discussing, please consult a healthcare professional. Your health is worth it. All right, let's jump right into the first sign: frequent urination, also known as polyuria. When your blood sugar levels are high, your kidneys go into overdrive to remove the excess glucose from your bloodstream. They do this through your urine. Imagine your kidneys are like little sieves, and sugar is like sand. When there's too much sand, the sieve can only handle so much before some of it starts slipping through. The same thing happens with your kidneys and excess glucose. So, if you're making more trips to the bathroom than usual, don't just brush it off. It could be your body's way of telling you something's up with your blood sugar. Now, remember how we just talked about frequent urination? That excess fluid loss can lead to another sign: excessive thirst, or polydipsia. When you're constantly peeing, your body loses more fluids than usual, and naturally it craves to replenish them. It's like a vicious cycle. High blood sugar leads to frequent urination, which leads to dehydration, which makes you thirsty, so you drink more, and then the cycle repeats. So, if you're constantly reaching for that water bottle and can't seem to quench your thirst, it's worth paying attention. It could be a sign that your blood sugar is out of whack. Let's talk about another sign: extreme hunger, also known as polyphagia. We all get hungry, it's natural. But if you find yourself constantly ravenous, even after eating a satisfying meal, it could be your body trying to tell you something. When your body can't use glucose properly, like in the case of high blood sugar, it's like trying to run a car on empty. So, what does your body do? It sends out those hunger signals, urging you to eat more, even if you've already had enough. If you're experiencing an insatiable appetite, don't just assume you need to up your calorie intake. It's essential to listen to your body and consider if high blood sugar could be the culprit. Let's talk about a sign that might seem counterintuitive: unexplained weight loss. When it happens unexpectedly, without any changes to your diet or exercise routine, it can actually be a cause for concern. When your body can't use glucose effectively because of high blood sugar, it has to find alternative sources of fuel. It turns to your stored fat and muscle. So even if you're eating the same amount as always, your body might start burning through your reserves, leading to weight loss. If you're noticing a significant drop in your weight without any explanation, it's definitely worth getting checked out. Let's talk about a symptom that many of us experience: fatigue and weakness. We all feel tired sometimes, right? But if you're constantly feeling drained, it could be a sign of high blood sugar. Our bodies need fuel to function properly, and glucose is that fuel. But when your blood sugar is high, your body can't use glucose efficiently. As a result, your cells aren't getting the energy they need, and you start to feel sluggish and worn out. It's like your body's battery is constantly running low. If you're experiencing persistent fatigue that goes beyond just needing a good night's sleep, it's worth considering if high blood sugar could be a factor. Let's talk about a sign that can directly impact your vision: blurred vision. When your blood sugar levels are elevated, it can cause the lenses in your eyes to swell. This swelling can distort light as it enters your eye, leading to blurry or fuzzy vision. Imagine looking through a window that's slightly warped or distorted. That's kind of what happens to your vision when your blood sugar is high. So if you notice sudden changes in your eyesight, like difficulty reading or seeing distant objects, don't just dismiss it as eye strain. It could be a sign that your blood sugar is out of balance. Let's talk about a sign that you might not immediately associate with high blood sugar: slow healing wounds. When your blood sugar is consistently high, it can interfere with your body's natural healing process. High blood sugar can damage blood vessels and nerves, impairing circulation and affecting the delivery of nutrients and oxygen to your tissues. Proper blood flow is essential for wound healing. If the roads are blocked due to high blood sugar, the repair process slows down. If you notice that even minor cuts or wounds seem to be taking longer than usual to heal, or if you're experiencing recurrent infections, it could be a sign that your blood sugar levels are not in check. Pay attention to your body's signals. Let's talk about a sign that can affect your overall health: frequent infections. High blood sugar can weaken our immune system, making us more susceptible to infections. High levels of glucose in your blood create an ideal breeding ground for bacteria and yeast. When your immune system is compromised, it's less equipped to fight off these invaders. This increased susceptibility can manifest in various ways, such as frequent urinary tract infections, skin infections, yeast infections, or even more serious infections. If you find yourself battling infections more often than usual, it's essential to pay attention to your blood sugar levels. Let's talk about a sign that can affect your extremities: tingling or numbness in the hands and feet. These sensations can be quite unsettling and can sometimes be a sign of nerve damage caused by high blood sugar. When blood sugar levels remain elevated for extended periods, it can damage the delicate nerves in your body, especially those in your extremities. This condition is known as diabetic neuropathy. High blood sugar is like interference on those wires, disrupting the flow of signals and causing sensations like tingling, numbness, or even a burning pain. If you're experiencing these sensations, don't ignore them. It's crucial to seek medical attention to determine the underlying cause and receive appropriate treatment. Let's talk about a sign that might appear on your skin: dark patches of skin, also known as Acanthosis nigricans. This condition is characterized by velvety, darkened patches of skin that typically develop in body folds and creases. Acanthosis nigricans is often a sign of insulin resistance, a condition where your body doesn't respond to insulin as effectively as it should. Insulin is a hormone that regulates blood sugar levels. If you notice these dark patches on your skin, especially if they're accompanied by other symptoms on this list, it's crucial to get your blood sugar levels checked. Early detection can make a significant difference. Let's talk about a sign that you might not immediately associate with high blood sugar: increased irritability or mood swings. We all experience emotional ups and downs. It's a normal part of life. But if you find yourself feeling more irritable, anxious, or prone to mood swings than usual, it could be related to fluctuations in your blood sugar levels. When your blood sugar levels spike or crash, it can disrupt the delicate balance of chemicals in your brain, such as serotonin and dopamine, which play a crucial role in regulating mood. When your blood sugar fluctuates, it's like your engine is sputtering, causing those emotional ups and downs. If you're noticing unexplained changes in your mood, don't just brush it off as stress or hormones. It's worth considering if high blood sugar could be a contributing factor. Now let's talk about a final, often overlooked sign: persistent dry mouth and itchy skin. When these sensations become persistent and bothersome, it could be your body's way of signaling high blood sugar. High blood sugar can lead to dehydration. That excess fluid loss can dehydrate your body, affecting your skin and mouth. When your body is dehydrated, your skin loses moisture and becomes dry and itchy. If you're constantly reaching for that water bottle, applying lotion, or popping mints to combat dry mouth, it's a good idea to pay attention to your overall health and consider if high blood sugar could be a contributing factor. And let me tell you about Emily, a 37-year-old mother of two. Life was hectic, but Emily always pushed through. Lately, she'd been feeling incredibly tired, constantly running to the bathroom, and her vision seemed blurry. She chalked it up to stress and being busy. But these symptoms persisted, so she finally saw her doctor. A simple blood test revealed that Emily had prediabetes. The good news? Emily caught it early. By making positive lifestyle changes, she was able to improve her symptoms and prevent the progression to type 2 diabetes. Emily's story is a powerful reminder that we need to listen to our bodies. Early detection is key. Take care, everyone.